She'll start with Minister Anand's speech.
Bonjour.
Good morning.
Okay, this is embarrassing. C'est un plaisir.
I'm delighted to be here with you today with Minister Gould. Good morning, Karina. I will start, and then Karina will say a few words.
That we know that the battle against COVID-19 is a global one. And Minister Gould will speak to the international efforts that Canada is making on the global stage. I will begin by speaking about our procurements here at home and some of the logistical issues that we are addressing as vaccines come into this country. As you know, from day one, our government has been working diligently to ensure that Canadians have the equipment and the supplies that they need to see this pandemic through to the other side. Now, as a result of Canada's bilateral agreements with the world's most promising vaccine developers, Canada is charting its path forward towards recovery. Le Canada s'est doté.
Canada has a wide range of portfolios of diversified vaccines, the most in the world.
Privileged to be on hand as some of the first COVID-19 vaccines arrived in this country. That shipment was part of the first 30,000 doses of the Pfizer-BioNTech authorized vaccine. More shipments will follow shortly, with up to a total of 249,600 doses arriving by the end of this month alone. This is the first tranche of the 20 million doses that we have purchased from Pfizer to date. Notably, our vaccine portfolio consists of signed agreements with 7 vaccine manufacturers that will provide us with access to up to 414 million doses, the most number of doses per capita of any country in the world. In addition to executing the advance purchase agreements with vaccine developers, my department at PSBC continues to support the logistic side of the largest mass vaccination effort in Canadian history. À ce propos,
I'm therefore happy to announce that we have granted purchase orders to 5 Canadian companies to take care of the daily delivery of tens of thousands of kilograms of dry ice as needed. This dry ice will help to store vaccines at different temperatures.
That we have awarded standing offers to 5 Canadian companies to deliver tens of thousands of kilograms of dry ice weekly on an as-needed basis for storing vaccines at various temperatures. A key component of our contracts is that provinces and territories must be able to issue call-ups against these offers directly so that they too can quickly meet their immediate storage needs without delay. And we are pleased to be able to support the provinces and territories in this regard. Now for an update on freezers. When it comes to transporting and storing vaccines, we have now purchased 422 freezers, including 148 portable and 130 countertop freezers, as well as 322 ultra-cold freezers that can store vaccines at up to minus 80 degrees Celsius to accommodate the Pfizer vaccine. So far, we have received a total of 42 freezers, with more on the way this week and in the coming weeks. In closing, my department continues to focus on keeping Canadians healthy and safe. And with vaccine procurements, we are beginning to see the light at the end of the tunnel. But this pandemic is a global one, and it requires a global response. That is why today's announcement from my colleague, Minister Karina Gould, is so important. Nous continuerons.
We will continue doing everything in our power to fight against COVID-19 at home and abroad to make sure that Canada and the world be able to overcome this pandemic once and for all.
Merci, Megwetch.
We'll now go to Minister Gould.
Great, thank you. Good morning, everyone. It's a pleasure to be here with my colleague, Minister Anand, for today's briefing. Anita, I want to thank you for all the great work you have been doing on behalf of Canadians to keep us all safe, so thank you. But as you know, and as you mentioned, pandemics know no borders, and this pandemic continues to have a profound effect for vulnerable populations at home and around the world. And we will not be safe until everyone is safe. So it makes sense that when we find successful medical solutions, we ensure that it is a win for all. Since the start of the pandemic, our government has been committed to a robust global effort to end COVID-19 and the devastating health, social, and economic effects it has had on the most vulnerable around the world. Canada is doing its part to ensure that everyone, everywhere, has access to COVID-19 tests, treatments, and vaccines. Today, I am pleased to announce that the Government of Canada will contribute $230 million to procure COVID-19 therapies for use in developing countries, responding to urgent needs identified by the Access to COVID-19 Tools Accelerator, or the ACT Accelerator. Le Canada fait sa part.
Canada is doing its part to make sure that each and every one throughout the world have access to tests, treatments, and vaccines against COVID-19. Today, I'm pleased to announce that depending on the needs identified by the accelerator, the Canadian government will contribute $211 million for COVID-19 therapies for developing countries. We are working on this initiative in close collaboration with the Bill and Melinda Gates Foundation and UNICEF.
We are working in close collaboration with the Bill and Melinda Gates Foundation and UNICEF. This contribution will help to reduce the burden the pandemic is having on already stretched health systems in developing countries. It will minimize the number of deaths and cases of severe illness from COVID-19. Canada's contribution will make it possible for UNICEF to acquire up to 3 million courses of novel COVID-19 antibody treatments as soon as clinical trials and regulatory approvals are completed for deployment to developing countries around the world. This builds on important work with the Gates Foundation to secure dedicated manufacturing capacity for the production of novel antibody therapies that will be reserved for use in developing countries at low or no cost. The faster we can get tests, treatments, and vaccines out to people, the sooner this global pandemic can be contained. That is why Canada is also investing an additional $255 million to further support the critical work of the ACT Accelerator, which is a framework for collaboration to speed up the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. Plus nous réunissons rapidement.
The faster we work together to administer tests, treatments, and vaccines together, the faster we can contain this global pandemic. That is why Canada is also $1 billion in additional funds to support the critical work of the ACT Accelerator, which is a framework for collaboration to speed up the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. This global partnership allows for the effective deployment of medical solutions against COVID-19 in developing and vulnerable countries.
allows for the effective deployment of medical solutions against COVID-19 in developing and vulnerable countries. Canada's new investments with the World Health Organization, the Pan American Health Organization, the Coalition for Epidemic Preparedness Innovations, and Gavi, the Vaccine Alliance, will be coordinated through the ACT Accelerator. That way, the vaccines and therapeutics being developed will go to the countries and communities that need them most, including targeted support for Latin America and the Caribbean. As part of this, Canada will contribute $75 million to Gavi for the delivery and distribution of COVID-19 vaccines, including up to $5 million to help establish a mechanism to manage the global donation and exchange of vaccines between countries. Gavi is setting up this mechanism within the COVAX facility to allow countries to donate or exchange surplus vaccine doses so that every dose that is produced gets to someone who needs it. Gavi est en train de mettre en place.
Gavi is setting up this mechanism within the COVAX facility to allow countries to donate or exchange surplus vaccine doses so that every dose that is produced gets to someone who needs it.
Being announced today will training frontline healthcare workers in developing countries so they can administer COVID-19 vaccines and therapeutics. It will help countries reinforce their health systems to plan and execute mass vaccination campaigns and procure essential supplies such as syringes or PPE for the rollout of COVID-19 vaccines and therapeutics. Canada's investment of $485 million being announced today will reinforce the work of key partners and build on our commitment to make COVID-19 medical countermeasures more accessible for all countries. We are part of a global community, and our health at home depends on the health of everyone everywhere. Canadians understand that no one is safe from COVID-19 unless everyone is safe, and today's new commitments will help to make that possible. Les Canadiennes et les
Canadians have understood this. No one can be saved from COVID-19 for as long as no one is safe. Today's new investments will make sure that that becomes possible. We would work fast together to administer tests, treatments, and vaccines to people no matter where. And the faster we do that, the sooner this pandemic can be contained.
treatments and vaccines out to people, no matter where they live, the sooner this pandemic can be defeated. Canada's support of global efforts to get medical solutions out to everyone is a win for us all. Thank you. Merci.
Alors, nous avons 25 minutes.
We have 25 minutes for questions, starting on the phone with 3 questions, and then we'll cut to the room afterwards. Operator, we shall start 1 question, 1 follow-up.
Thank you. Merci. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Please press star 1 at this time if you have a question. La première question, the first question is from David Aiken of Global News. Your line is open. Please go ahead.
Thank you very much. I guess questions for Minister Anand. Just on the allocation per capita, and I know some provinces have got a little extra based on some at-risk populations. I'm just a little curious why the federal government, at its COVID website, among all the information there, wouldn't list number of doses received, number of doses to Manitoba, to Quebec, to Nova Scotia, and expected arrival times. Is there any intent to distribute that or publish that?
Oh, well, thank you so much for the question, David, and I will definitely take that back to my colleagues in the Ministry of Health in terms of the information that they are discussing with the provinces and territories. From my part, in terms of the procurement end, the number of doses to the exact number is one that I'm always trying to ensure is specific before I come and tell the Canadian public exactly what is coming into this country. And so, as you know from our past discussions, I will make sure that I have that precise information before I throw out any information. But in terms of the information that we're trying to get out to the Canadian public, we are trying to do that as soon as possible as it becomes definitive. And again, I'll take that back to the colleagues that I have at the Ministry of Health to see about further information on the website.
Okay, thanks. And sort of related, I suppose, on the communications front, if all the vaccines were here today, we would still possibly have an issue convincing a lot of Canadians that they're safe, that you can take it, how to take it, what are the instructions. And I'm just wondering if you have a budget for a marketing plan to buy some ads, things like that, to in order to prepare Canadians for when it's in widespread use, to create the demand that we all need to take this vaccine and that it's safe. Can you speak a bit about the communications or marketing plan to get Canadians all excited about getting this thing?
Well, again, thanks for the question, and it is a good one. As we see vaccines rolling out into this country, we are confronted with a number of different types of reactions to the vaccine, but I want to start by saying that I have full confidence in Health Canada and the expertise that they bring to the table in terms of the approval of the Pfizer vaccine and additional vaccines that will hopefully be approved. Of course, that's a process that is separate from the procurements, for example. But in terms of how we as a government are addressing the various reactions that individuals have, I believe that all elected representatives have a role to play in supporting scientific research and the decisions that our independent regulator at Health Canada is making. That is why I was concerned when in the official opposition, there was a member of that party that was circulating an anti-vaxxer petition. By the same token, I think we need to make sure that all of us in government who are coming to the table expresses the importance of following the science, ensuring that we have faith in our experts in this area. We do hold technical briefings every week where Health Canada officials are present, where procurement officials are present, and where PHAC officials are present in an effort to provide as much information to the Canadian public that they may seek or want in order to have as much information as possible about the vaccines and perhaps become more comfortable with the vaccines and taking the vaccines. In addition, I have heard of various efforts among cultural groups in various communities that are speaking directly with their communities, in particular the South Asian community, to ensure that vaccines are safe and effective once approved by Health Canada. And then I will finally say, in procurement, is that the vaccines arrive in this country. It is a cross-government approach to ensure that we have information that is provided to Canadians so that they are comfortable with approved vaccines that are safe and effective. Our government is focused on that. I know that the Minister of Health, Patty Hajdu, is also focused on that, and I'm sure she will have more to say on that once she's here with me again.
Thank you, merci. The next question.
Operator, hang on. We just have, Minister's just going to repeat one part in French. Thanks.
Je pense que
I believe that everyone in government, and particularly in Parliament, has a responsibility to listen to science and the vaccine approvals from Health Canada. So I was concerned when I saw that there was an MP, an opposition MP, who filed a petition stating that vaccines are not effective. That is an anti-vax movement which I feel is somewhat dangerous in this environment. At a time of a health crisis right here in our country and throughout the world, it is a responsibility for all our MPs to listen to science.
We'll take the next question.
Thank you, merci. La prochaine question est de Catherine.
Catherine Lévesque, La Presse. Good morning. My question is for Minister Gould. First of all, I would like to know if this is new money that's being announced today. Who do we want to help specifically with this money? Thank you very much, Catherine, for your question. Yes, it is new money that we are announcing today. There's no specific country. Our contribution today is going to the multilateral system to make sure that the money goes where it is needed and to make sure that it's a fair response for the poorest and vulnerable countries in the world. Yes, this is new money, and this is a global response together with our multilateral partners to make sure that we have an effective response. Follow-up question, and this is either for Minister Gould or Minister Anand. The government has repeated several times that Canada has a very broad range of vaccines, a vaccine portfolio. If we have to, it be possible to send it to the most vulnerable countries as well? Answer. Let me start, and if Anita wants to add to my response, she can do so. As I said on several occasions, Canada is one of the leaders when it comes to fighting COVID-19 and health crisis in the world. We are the second largest contributor to the COVAX facility, which was set up to make sure that developing countries have fair and affordable access to vaccines. We have a strong voice on the international scene to make sure that there's access to vaccines. And as I announced in my speech earlier, we are working with Gavi, the Vaccine Alliance, to set up a governance mechanism to make sure that there's a facility and fair governance for nations when it comes to exchanging vaccines as necessary when they become available. And as I've said on several occasions, the discussion about surpluses is a theoretical one, thanks to the excellent work being done by my colleague, Minister Anand. Canada has the most diversified portfolio in the world, and this is excellent news. We are getting ready to receive the first doses of the vaccine. But we don't have any excess capacity now. We are still receiving the initial doses. Maybe when we will find ourselves in that situation, we could have that conversation. But now, only one vaccine has been approved by Health Canada. We are just about to receive the first doses, and we do not know if all the vaccine candidates will be approved by Health Canada. We are following up clinical trials, but of course, we have a strong voice. We are a leader, and we are demonstrating our leadership on the global scene to make sure that there is affordable and fair distribution. Minister Anand, I would like to add something. Thank you very much, Karina. It's true. That's a good question. We have the largest vaccine portfolio, 414 million doses in the world. At the same time, it's somewhat too soon to decide which vaccine we could give to other countries, because now we have only one approval from Health Canada. So there's still a lot of work to be done. In the coming months, we will make other decisions to help other countries. But today, Minister Gould's announcement is a promise to help other countries when we will be able to do so. Thank you. Next question.
The next question is from Jamie Pashagumskum of APTN. Your line is open. Please go ahead.
Hi, thank you. This question is for Mr. Anand. You were mentioning the freezers that were required to transport this Pfizer vaccine. We all know it's a fragile vaccine. Do you foresee any problems transporting it to remote communities? If not, do we have the freezers available now to transport it?
Well, thank you for the question. And indeed, we are very focused on all aspects of the supply chain, including an end-to-end logistics system that we have in place with FedEx that we announced last week. And that end-to-end system is up and running now. We were very pleased that FedEx was able to step right into the role of working with Major General Danny Fortin and his team at the Public Health Agency of Canada to ensure that there would be a seamless distribution of these deep freezers across the country. We are making sure we have all different types of freezers procured, so countertop, portable, and the standalone deep freezes. We are in the process now of making sure that all communities that will be receiving the Pfizer vaccine have these freezers. But in addition, should additional vaccines receive Health Canada approval, we will make sure that those communities have the freezers also. So the short answer to your question is yes, we have this end-to-end logistics system in place. We have procured the freezers, 42 of which have arrived to date, with more on the way in the coming weeks and months, and those will be in place to receive the doses. In addition, we have the dry ice that is supplementing our freezer capacity and the ability to store and transport doses.
Follow up?
Yes, thank you. Okay, you said it's in the process and in the coming months. How about for communities that are really hard hit who might need a vaccine right away, like Shamattawa and Fond-du-Lac? When can they be expecting these?
Well, again, a very good question because, as you know, this government, our Prime Minister, and all ministers are very much focused on ensuring that our vulnerable communities have the necessities that are required for surviving and making it through to the other side. And in that respect, I was very pleased that we were able to ship hundreds of shipments of PPE to vulnerable communities. In terms of the ability to receive doses, we know that the Pfizer fragile requiring minus 70 degrees Celsius refrigeration or freezer temperatures. And so we are hopeful that additional vaccines, as they come online and are approved by Health Canada and that are able to be stored at less cold temperature to transport to those communities. And by all means, we will be making sure that those communities have the refrigeration and freezer capacity necessary to ensure that vulnerable populations are indeed well served. And I'm sure we will have more to say on that in the coming days.
Glenn will take a question.
Hi, Glenn McGregor, CTV News. Minister, the anti-vax conspiracy theories that you referred to, they really take hold when people don't feel they're getting straight in government about vaccines. Last week, you were asked about liability and whether or not the government indemnified Pfizer for anything that goes wrong with their product. Now, I know you've set up this compensation fund, but people are rolling up their sleeves today, getting the shot, without knowing if the company that makes the drug has effectively washed its hands of any legal liability for it. Can you say yes or no, in those contracts with Pfizer, did the government agree to indemnify them against liability? And if you won't say, can you explain why?
Well, thank you, Glenn. You were the one who asked the question, so I appreciate you coming back and clarifying. Let's be clear that indemnification clauses in vaccine contracts are standard. All countries, generally speaking, are faced with the issue of indemnification of companies, especially in cases of novel technologies like this. And is for that reason that we wanted to ensure that we had a compensation regime in place so that if in the rare instance that there was an issue with any type of new technology, that we were able to offer the compensation regime and the protection to Canadians. Because at the very end of the day, we do want Canadians to be comfortable with this vaccine. We want them to abide by the science that we ourselves are supportive of. And that is the entire premise of the procurement of vaccines, indeed, right? The idea that they would get Health Canada approval and therefore be deemed to be safe and effective is fundamentally important to us having this successful vaccine strategy. That's why you won't see any rollout of a vaccine until Health Canada approves it. By the same token, however, it is important, as you say, for Canadians to know that if there is an issue at all with the technology in these novel vaccines, that they do have access to a regime that aims to protect them. And the reason why I am supportive of a compensation regime like the one that was announced last week isn't just that it provides the protection to Canadians, but it's also agnostic as between the deep pockets of one Canadian versus another. In other words, you don't have to have deep pockets in order to access that regime. Indeed, in introducing the regime, we are simply building on what Quebec has had in place for years and what all other G7 countries have in place. So I am very pleased, especially as one who has familiarity with compensation regimes from my past life as a professor at the University of Toronto. There is value in this for Canadians.
Just to be clear, that's a yes, we are.
That is, yes, we are, and we are definitely not any different than any other country in this world.
We'll start with, we'll go with one question on this side of the room.
Laurence Martin de Radio-Canada.
Question. We have 30 million doses arriving, 30,000 doses arriving. When will the next doses arrive? Is it this week, next week? Just for clarification purposes. Answer. That's a good question, as usual. Yes, it's 30,000 doses this week and about the same number for the upcoming weeks. But those are details that we are now finalizing. I hope I will be able to give you more information later this week after speaking with the supplier. Question.
We are finalizing the precise numbers of the shipments coming next week and the weeks after. We are looking at 30,000 shipments this week and about similar numbers next week. And when I have the precise numbers, I will come back and give you those numbers.
Follow-up question. Some provinces like British Columbia are saying that with the doses we'll receive this week, we are going to use them all. We are not going to keep some. I don't know if they're going to receive 3,000 doses. We will not just take 1,500 and then wait another 21 days to vaccinate the same people. So we will use all of the doses with the hope of vaccinating more people when we receive more. Is this a mistake, saying we vaccinate the most people we can with all the doses we receive? Answer. I'm very careful with stating figures that I know with certainty. My team and I speak with suppliers every day to make sure that supplies would be sent here and to find out when. Like everyone else, I know that many people want to have vaccines right now. That is an objective. We had already received the doses in Canada right now, this month. That was not the case 2 weeks ago.
We were still in negotiations with suppliers to ensure that we could get doses into Canada. We came immediately to tell you the numbers that we had achieved with Pfizer. Mais maintenant, les
But now we have the same conversations, very important conversations, but lots of details. But I don't want to give you incorrect information right now. I hope that this week and even next week, I'll be coming up to give you specificities about the negotiations. It's a very competitive environment everywhere in the world. Every country wants to have the same product, the same doses. So we have to negotiate very hard for Canada to make sure that we receive more doses as soon as possible. And that is work for me and my team every day. Is that a good answer?
We'll go to this side of the room. Go ahead.
Hi, Minister. Chris Reynolds, Canadian Press. What is the status on procuring a computer system for tracking vaccine distribution, and why is that work only being done now when the vaccine is already being administered?
It's a really good question, Chris, and I want to start by saying that it is important to remember that the Public Health Agency of Canada has information systems in place at the current time. You'll have to remember that we have been procuring the flu vaccine for decades, 11 million in usual years, a little over 15 million this year. And you can imagine that with those procurements and distributions that the Public Health Agency of Canada would have had a logistics system in place as it does. The work that we are doing in PSPC now is to ensure that we are able to supplement existing systems with greater usability, with greater functionality in those systems that is required because of the complex and fragile nature of these vaccines. In addition, we need to make sure that we have national capability for vaccine tracking. And so that work is being done now in very short order in order to supplement the existing IT regime. And as you know, for national security purposes, we have to conduct this procurement with suppliers directly, and we will be sharing information with you once those procurements are in place. The bottom line is that we are supplementing existing IT systems. We are going to provide the information regarding this procurement as soon as possible.
Okay, we'll take one more question from the phone and then come back to the room for one last question.
Thank you, merci. La prochaine question est de Mélanie Marquis, La Presse.
Mélanie Marquis, La Presse.
Minister Anand, a Pfizer executive told one of my colleagues that Pfizer was actually ready to send more doses of the vaccine, but that they were kind of dealing with a lack of preparation from the provinces, I guess, over vaccination sites. Can you just let us know if the provinces and territories are indeed ready to receive as much vaccines as we could be receiving?
Well, thank you so much. It's a fair question, and it's fair because there are so many moving parts in this process of the largest mass vaccination that our country has seen. Having said that, we have a very responsible and competent system at the Public Health Agency of Canada with the expertise of Major General Denis Fortin that is working directly with the provinces and territories to ensure that they are ready to receive vaccines. And indeed, one of the issues that what's fundamental to us receiving these early doses was the provincial and territorial readiness. And I was very pleased when the supplier had comfort with the systems that we already have in place, that we are continuing to perfect in the provinces and territories to receive those vaccines. Now, of course, in this federation, we do see varying levels of readiness and programs and processes in place in these jurisdictions. But we are all seeking to reach the same goal, which is to ensure that vaccine suppliers can bring their product into Canada and get it out to the provinces and territories aussitôt que possible. And that is the work that I am doing every day with the Public Health Agency of Canada and with Major General Denis Fortin.
Well, Srivi Melody?
Just to be clear, is that a yes? Could we be receiving, as we speak, more, and until the end of the year, more doses of the vaccine if the provinces and territories were more advanced in their readiness?
So I cannot speak to what third parties are saying to you. I can speak to what our contracts say. And we have an agreement with Pfizer to provide up to 249,000 doses before the end of the year. We are on track to receive 249,000 doses before the end of the year. And that is the reason why those are the numbers I am giving you. I would very much like to continue the discussions with all suppliers regarding early doses, and I will always have that conversation.
Okay, and last question. Go ahead.
Marika Walsh with the Globe and Mail. Minister, you said that you're expecting 30,000 this week, 30,000 next week, but what next? Why is there less certainty around that? Can you say specifically when it will ramp up and when we will see these mass vaccinations that we're seeing, for example, in the U.S. so much sooner?
Well, as I have mentioned in a previous response, we are dealing with an incredibly competitive global environment where vaccine manufacturers routinely are having global allocation meetings, meaning they are deciding which vaccine doses go to which country. Because Canada signed an agreement early with Pfizer and indeed with our vaccine manufacturers, we've been able to negotiate hard with fortitude to bring early doses into this country, continuing to firm up the delivery schedule with Pfizer as they have conversations with other jurisdictions, all of whom are competing for these doses. We have been assured, as a result of being one of the earliest countries to sign with Pfizer and other suppliers, that we are at the front of the line for those doses. But the important thing that we want to make sure is that all Canadians get vaccinated, not just those at the front of the line. So it's very much the long game here. We need to make sure we're getting doses into Canada aussitôt que possible, as soon as possible. But at the same token, we need to make sure that we have the timelines that we've set out already for Canadians being met.
You didn't specify when that ramp up will happen, but I'm wondering how this figures into or factors into what Chris was asking you about the fact that Canada is only now trying to procure an IT system that it itself is calling mission critical. Why are we so late to ordering something that's being called mission critical to this? And what, if any, impact does that have on how many vaccines we can take in right now?
Well, Marika, I actually reject the premise of your question. We are not just now telling you about the rollout of the vaccines and when they are coming, but the first
IT
part of your
system.
question did deal with the timeline. And last week at the technical briefing, we had officials at the table who were providing information to Canadians on the rollout of the vaccine. And it's really important for all Canadians to know.
Minister, it just says between April and December, enough will be for all Canadians.
And the next thing that I wanted to say is that we provided information relating to Q1, Q2, and Q3. And the reason why we are dealing with those timeframes is because when we negotiated these contracts in the middle of August, there was not certainty about whether there would even be a vaccine discovered or whether a vaccine would be approved. We are right now where a vaccine has been approved, and we are therefore in the moment where we are negotiating the precise delivery dates. And the IT system is part of the end-to-end logistics system that we are assisting the Public Health Agency of Canada with. So when we get requests from PHAC to undertake procurements, whether it's on PPE or vaccines or IT systems, we immediately act, and that's exactly what we are doing.
Okay, that marks the end of the press conference.
Yeah, I wanted to just clarify that. Like, how does 30K this week and then 30K next week add up to 24,900 at the end of the year?
Can I just pause on these questions for one moment, just to clarify that I said 30,000 this week. I did not say 30,000 next week. I said a similar shipment. I'm trying to confirm that number for next week, okay? There are more days in December, and we will provide the information as soon as we get it from the supplier, which I hope will be this week. I have been in touch directly with the CEO to ask for this delivery schedule, and I expect it to be forthcoming very soon.
That's the end of the press conference. Thank you.
Thank you, everyone. Merci beaucoup.
Thank you. Merci. The conference is now